What employers should know about drug abuse. Opioid use disorder is the continued use of an opioid despite clinically significant distress or impairment. It typically includes a strong desire to take the drug, difficulties in controlling its use, persisting in its use despite harmful consequences, a higher priority given to the drug use than any other activity, increased tolerance, and a physical withdrawal state. Most often, people with opioid use disorder are gainfully employed. Continued use and misuse can lead to physical dependence and withdrawal symptoms. And after a while, people must take opioids just to avoid the physical withdrawal symptoms. Actually, they take it so that they can just feel normal. Although some damage can occur with short-term drug use, the most extreme changes to the brain and body typically occur with long-term use and misuse of opioid painkillers. Employers should know that opioid use disorder affects all races, all ages, and every socioeconomic group. There's no one that's not affected by these drugs. Warning signs. Changes in personality and behavior like a lack of motivation, irritability, and agitation. There's also criminal behavior focused on obtaining money for drugs, and shakes, tremors, or slurred speech. Those are warning signs. Also change in their daily routines, lack of concern for personal hygiene, and unusual need for money and financial problems, and changes in friends and activities. Physical symptoms: noticeable elation or euphoria, marked sedation or drowsiness, confusion, constricted pupils, slowed breathing, intermittent loss of consciousness, constipation, and being on the nod. And being on the nod is described as a semi-conscious state, and it looks like the person is falling asleep, but if you ask them a question, they could readily answer that question. Other signs are doctor shopping, meaning that the person goes from doctor to doctor trying to obtain opioid drugs. Shifting or dramatically changing moods, social withdrawal, sudden financial problems, or criminal activity to obtain drugs. Reducing stigma. By acknowledging that opioid use disorder is a disease, the barriers to seeking and accessing treatment can be reduced. Understanding that opioid use disorder is a disease leads to empathy for the person with the disease and will help to encourage people to seek and access treatment. People who struggle with opioid use disorder face a wide range of stigmas. Stigma is a mark of disgrace that sets a person or a group apart. When people are labeled primarily because of their opioid use disorder, they're being negatively stereotyped. Language that includes biased and hurtful words can lead to discrimination and social exclusion. Stigma and discrimination are barriers to acknowledging the problem, seeking and accessing treatment, and ultimately to recovery. Language is powerful, especially when talking about addictions. Here are some examples of stigma-reducing language that should be used. So, say a person with opioid use disorder instead of addict, user, druggie, junkie, or abuser. Say disease instead of drug habit. Say person living in recovery versus ex-addict. Say person arrested for a drug violation versus drug offender. Use substance dependent versus hooked. Say medication is a treatment tool versus medication is a crutch. Say had a setback versus relapsed. Say maintained recovery and are substance free versus stayed clean. Say negative drug screen versus clean. Say positive drug screen versus dirty drug screen. With treatment comes the hope of recovery. People need to know that recovery is possible. The first step to recovery is recognizing that a person needs help. To learn more about recovery, visit www.samhsa.gov/recovery. You can also visit other videos at lookupindiana.org. Prevention. Prevention is the best strategy. Prevention starts by talking with adolescents about the dangers of drugs. Early use of drugs increases a person's chances of developing addiction. Here's a slide that shows the drug danger zone and that most illicit drug use starts in the teenage years. Remember, drugs change brains, and this can lead to addiction and other serious problems. So, preventing early use of drugs or alcohol may go a long way in reducing these risks. If we can prevent young people from experimenting with drugs, we can prevent drug addiction. And for further information, go to lookupindiana.org.